The cold, darker winter days, hey, they can be tough, right? Tough for all of us, but especially for our mental health. And for those who suffer from seasonal affective disorder, they can be hit the hardest. Symptoms really get to peak in January and February, especially this time of year. And so again, it's cold, dark, and people are really suffering. Right now, a lot of us, right, are spending time inside. Why? Because of the shorter days. You have less days and less daylight and super cold temperatures. I mean, around here, it's I'm in southeastern Michigan. It's 10 degrees Fahrenheit. So hey, we're inside. So it's really not uncommon for us to feel a little sluggish or down. So, how can someone tell if they're feeling just the winter blues, right? A lot of us get that, or if they actually may have seasonal affective disorder. So, important question. Now, a lot of people think that the winter blues or seasonal affective disorder are the same thing, right? That they're interchangeable, but they're not. The winter blues are is not really not a medical disorder or a medical diagnosis, and while it's pretty common, it's usually mild. That is, the winter blues are usually mild. Then you can go about your day, do your things, do the things you enjoy, and you have ups and downs. The winter blues also tend to go away on their own in a short amount of time. Now, let's take S.A.D, or seasonal affective disorder, or S.A.D. Now, that's a mental health condition. It's a medical diagnosis, and it's a form of depression that can come and go around the same time each year. And it can significantly impact your daily life. That's a critical part of it, that it actually impacts your daily life significantly. And so, what symptoms can you think about or look for when you think about having seasonal affective disorder? Symptoms include persistent sadness. You have loss of interest in activities, stuff you normally enjoy, you no longer enjoy. A low energy, sleeping a lot. So excessive sleep can be a potential symptom. Weight gain and difficulty concentrating. You really can't zoom in. And you even have feelings of hopelessness. You really don't know what more you can do. Now, SAD can even interfere with work relationships, right? And overall well-being. So listen, interpersonal relationships can be affected. So it really can be quite crippling for many people. So a lot of people ask me, Dr. Nandi, why does this happen? The exact cause isn't clear among scientists who really study this quite deeply, but we feel that this lack of sunlight this time of year is a big factor, right? I mean, if I'm in Michigan, I see so little sun during the winter, and a lot of states in this part of the world can have that, and all over the country here in the U.S. and many parts of the world. So less sun can affect your two important chemicals that affect your brain: serotonin and melatonin. Now, these two chemicals can regulate mood and sleep. Super important in how you feel, how you function. Also, vitamin D, well, it's made in the skin when exposed to sunlight, which then can boost serotonin levels. So when vitamin D levels, when they drop in the winter, guess what? It can affect how you feel. Serotonin is the feel-good hormone, right? So what can we do to feel better? Is all hope lost, right? I mean, that's the thing. You're talking about lack of sunlight. What are we going to do? So some treatment options I'd like to go through with you. First of all, the good news is that there are ways to manage SAD or SAD. Simple lifestyle changes, like getting outside, for example. Even if it's a bit cold, get outside during the daylight hours, and then stay active. And even maybe take a vitamin D supplement. Talk to your doctor about that. This can make a difference and really help elevate or boost your mood. Now, what about other types of treatment? Well, light therapy is really considered an effective option. It involves sitting near a special lamp that emits 10,000 lux of light to really kind of mimic the sunlight that you're not getting. That can be quite effective. Another great option, it's a type of therapy, type of talk therapy we call cognitive behavioral therapy, used for other types of diagnosis as well. And the research here is pretty good. It shows that it can have the longest lasting benefits, which is what all of us really want. Teaches folks how to identify and cope with negative thoughts and symptoms. And that's an important part of this, to be able to cope with some of these problems that you're having. What about medications? Medications can also help in certain cases, and can really be able to have you, get your arms around the symptoms and get treated. So, listen, if you're listening to this or you are watching this and you're struggling with symptoms that can make daily life difficult, I don't want you to ignore them. Know that there's treatment. It's important to take S.A.D seriously. If left untreated, it can really get worse and lead to social withdrawal, substance abuse, and other mental health issues. You can get anxiety, and even some people suffer with suicidal thoughts. It's really important to understand that this can really affect your life, can be quite serious. So, if you think that you may be suffering from this, it's really important to talk to your doctor or healthcare provider, get the right diagnosis, get the right treatment plan. And you don't have to go through this alone. A lot of us feel alone, like, nobody understands this, but you're not alone. You can get to a healthcare provider, get the treatment you need, and really figure out how to make yourself feel better. So seasonal affective disorder, very common, but doesn't mean you have to be crippled by it. There are solutions, and get to your doctor and make use of those solutions so you can really live the best life that you deserve.